For every man's problem, there is a solution given by God. In the case of infertility, there are way outs. And so that is the essence of this program. Hello there, thanks for joining us on yet another edition of Fertility Half Hour. My name is Clement Barikui, and today I'm not doing this alone. I have experts with me in the studio to talk about the problems associated with infertility. With me in the studio is Dr. Nsikak Nyuko. Doctor, you're welcome to the program.
Thank you very much.
And in case you are just joining us for the first time, Dr. Nsikak is a consultant obstetrician and gynecologist, and he is also a fertility consultant. Also with me is Dr. Okechukwu Kalu. Doctor, you're welcome.
Thank you very much. Hello, viewers.
It's good to have you in the studios today.
Thank you.
All right. Doctor is also a consultant obstetrician and gynecologist, and he's also a medical director, Life Point Fertility Center here in Uyo. Doctor, before we go into the program proper, let's just look at PCOS. Today we are talking about PCOS. What actually is PCOS?
Thank you so much. Well, when you hear the term PCOS, it means polycystic ovary syndrome. Now, syndrome in medicine refers to any constellation of signs that a physician can elicit and symptoms that patients have. So when you have a syndrome, that means those signs and symptoms are always occurring in a particular condition. So you say it's a syndrome. In the case of the polycystic ovary syndrome, it was clearly defined for the first time, described for the first time in 1935 by Stern and Leventhal. So initially they used to call it Stern-Leventhal syndrome. Now, different people have tried to define polycystic ovary syndrome over time, but the consensus that have been adopted is that in 2004, when they had a meeting at Rotterdam, and it's called the Rotterdam Consensus, and that is one that has been accepted till today as a definition. It is a clinical syndrome that is characterized in women, young women, characterized by menstrual disturbance as a first thing, also ultrasound or laboratory evidence of hyperandrogenism. Hyperandrogenism means the blood picture resembles that of the male, tends to be like that of the male. We'll discuss this in a moment. So they have menstrual disturbance and they have hyperandrogenism. And when we do a scan, you will be able to see that the ovaries appear polycystic. Either one or both of them appear polycystic. You require 2 out of these 3 to be able to diagnose polycystic ovary syndrome. Truly, before now, it was more diagnosed in the West. But with changes in diet that all of us have, many people have adopted the Western diet, it is now so much more common amongst young people in our environment. Okay,
you've talked about diet, but we'll come to that later. Looking at the name, polycystic ovary syndrome,
yes.
We've discovered that most man's diseases or sickness are given the names based on where it is found. So, is it because can you explain this more? The name polycystic ovary, why the name?
Okay, thank you. Basically, that was the first thing that was discovered. The feature on ultrasound scan, seeing small follicles. Follicles are the free cavities that you have the germ cell, that's the eggs of the woman within the ovary. So normally, when the follicle of a woman grows to a particular size, it would burst, and that bursting of the follicle is referred to as ovulation. But for these persons, they have problems. The menstrual disturbance shows the underlying amenorrhea. They are not menstruating. The menstrual disturbance is normally amenorrhea, and it shows that they are underlying anovulation. These women do not ovulate, though they have all these many follicles. Usually about 12 or more follicles in an ovary or both. Small, they are normally less than 1 cm. this follicle less than one centimeter. So they are normally require the follicles, they keep growing to about 2 cm or more before they burst for you want to ovulate. For these women, they remain at that point. Now it can be misleading because we're saying it's in the ovary, but actually it's a multi-systemic problem. It's the major problem that the women have. The major problem is the term insulin resistance. That's what is causing all the problems they have, and that's why it's a disease of lifestyle to an extent, to a large extent. Insulin resistance, so that the end organ, being the ovary now, is not able to do its normal function of allowing these follicles to grow, then they ovulate. It is still not fully elucidated. The problems is not yet clear of what is causing this insulin resistance. What is not incontrovertible is that they have insulin resistance.
Okay, to Dr. Onyoyoko. Doctor, let's look at how common is PCOS in let's say maybe Nigeria, particularly focused to Akwa Ibom State. How common is this element?
Okay, thank you very much. And polycystic ovary syndrome is quite common. In fact, it's getting commoner by the day. The worldwide incidence is 5 to 10%. Meaning that we're talking of, in the gathering of 10 women, one of them will have PCOS. But in Nigeria, we've discovered that various studies have taken the incidence to as high as 18-20%. Okay, including Akwa Ibom State. We keep seeing women coming with polycystic ovary. I think this probably is rising, just like Dr. Carlo has said, because of the dietary modifications of our people adopting the foreign diet. Also, there's also the increase in use of diagnostic tools. Okay. Like we have ultrasound almost everywhere these days, so people are able to check themselves and get diagnosed. And also, people are becoming more health seeking. You know, a lady before would miss her period for 3 months and would see it as normal. Yes. But a young lady now would want to seek care, want to seek a solution to, or to even ask what is the problem. And that's why we have been more and more diagnosis of polycystic ovary syndrome. So it's quite common among women of reproductive age group. It's actually a disease that is commoner in the women of reproductive age group.
All right. So to Dr. Kalu, in the course of this program, particularly, I remember in the last episode or so, we were talking about IVF, and you've just mentioned that people that have PCOS, they tend to have so many follicles, and then these follicles. So now let's marry it to IVF. People with PCOS, what are their chances of succeeding during PCOS?
Thank you. Truth is that a lot of the patients with polycystic ovary syndrome would end up requiring IVF, a good number of them. And interestingly, they tend to actually get pregnant, succeed with IVF more than the normal patient population. However, unfortunately also, the risk of abortion is higher with them. It's in fact higher with them. So they tend to get pregnant more. In fact, it's one of the causes of recurrent abortion, miscarriage. The woman doesn't know she has gotten pregnant and miscarried very early trimester miscarriage, one of the common causes. So they get pregnant more with IVF, but miscarriage rate is generally higher. Okay. So they benefit very well from IVF.
Okay. But I read somewhere, and I understand that their eggs tend not to be viable for
process. Thank you. To answer this question and to describe what is happening, it's good to look at what happens to the woman. All right, a woman, when it comes to fertility, is running a race against time. It's a race against time in the sense that when a woman is born, the woman has about maybe 5 to 7 million germ cells. Germ cells means things that will form the eggs. 5 to 7 million by the 5th month of her term life, when she's still in her mother's womb. By the time she is born, these 5 to 7 million has reduced to 1 to 2 million of these germ cells. By the time she gets towards puberty, that means they are all undergoing a process of apoptosis, and they continue going, it continues going down. It's a steady movement down the hill. By the time she gets to puberty, she has about maybe 500,000 of these germ cells remaining, and they continue that way up to menopause. By the time where she will have less than 50,000, and each month about maybe 15, a particular number of the follicles are mobilized to come out of that athletic cycle where they keep dying, to develop, and they have the potential of ovulating, all of them. But one particular selfish one will now take over and be the only one that will grow more and ovulate. And that's what gives rise to human beings. That's why human beings probably are also very selfish. So that's what happens on the general level. Now, for those that have PCOS, this process is quickened. This process of atresia is quickened. So they tend to lose their eggs faster.
Okay.
So there's a woman can be maybe 25 years, but her ovarian age is about 40. She's 25 years, she has PCOS, but the real ovarian age is about 40 years. So if you treat the woman as a 25-year-old, you're not going to achieve much. You say, you're still young, PCOS, we'll do this and do that, you're going to use the eggs. And you do, if you don't check, appropriately assess them, to know that the ovarian reserve has already gone down, and look for a way either to do what you have to do on time. Tell them, look, you're 30 years or whatever, I don't think you need to wait again. Because normally for them, a major measure of fertility or of ovarian reserve, known as the intrafollicular count, and also the AMH, anti-mullerian hormone level, is normally high. Okay. Very, very high for them. But for higher than normal population, but it also goes down rapidly. So by the time you have a woman with PCOS that has a normal intrafollicular AMH or a low AMH, that means her ovarian reserve has gone down so much, even if she's still very young. So you advise, look, you need to go beyond normal treatment. You need to go 5 years.
Okay. So in that direction, but maybe Dr. Nyoko will share with you on the causes. The possible causes of PCOS. We know that this cannot just come except you tell us that it's hereditary.
Yes, thank you. Yes. If you tell him to tell you, okay, I thought he would take that causes of PCOS, but because really, there's both environmental factors like we have already said, causing it, and also genetic. There's a genetic component, but it's not very strong. Both environmental issues and genetic working together will predispose a woman to PCOS. Yes, because it's not all the women that have Western diet that develop PCOS, but those that have some genetic predisposition, when they are also exposed to these environmental issues, especially when they are very young, they are predisposed to. By the time a young girl is being pampered, taking a lot of refined food, very young, she's at risk of having this PCOS. So it's something that you can start preventing with the younger children. Yeah.
I don't know, Dr. Nyoko, you have something to add?
Okay, yes. The actual cause of PCOS is not known. Okay. It also has a genetic component. That's why I laughed when you mentioned it. As if you knew, it's a familiar component of it. So there's a 35% risk of a daughter, having PCOS if the mother has. There's also a 40% risk of a daughter having PCOS if the sister has PCOS syndrome. And like he said, the underlying, even though it's not known, but at least we know the pathophysiology. The underlying issue is hyperinsulinemia and increase in luteinizing hormone secretion, which ends up causing hyperandrogenism, which is like a male pattern of hormonal milieu in the patient. So the ovary now, rather than being estrogenized, which is the female hormone, the hormonal environment is that of a man, and so it makes the follicles that are supposed to grow to be atretic, to be struggling to grow. It suppresses the growth of those follicles. The follicles now are mobilized in large quantities, more than 12. But they're not able to go beyond that 1 centimeter to get to the point where at least one of them would ovulate. So by and large, because which is not known, what I tell my patients, though, to make them not feel too bad, is that it's a variant of normal. If I, as a woman, I menstruate every month, probably your pattern is every 3 months. I give them that hope because it can only be managed, but cannot be treated. Okay,
but very important, truly, please. It is not only menstrual problem that's the issue. Because I thought we would have at least looked at the symptoms.
Yes,
I
think we look at the symptoms, and then we are also going to get an advice. You know, you are an IVF expert, so we are going to get an advice from you whether how best, maybe someone that has PCOS, how best the person can go about it to get a successful IVF. But that will be after the break. So you are still watching Fertility Half Hour, and I've been speaking with two doctors with me, but we will continue with the program after this break. Please stay with us. Welcome back, and thank you so much for keeping faith with our program Fertility Half Hour. Today we've been talking about PCOS, and I'm sure you've learned a lot. Don't forget that this program is proudly supported by LifePoint Fertility Center here in Uyo. And if you have any inquiry, any question, or anything that you want to find out about IVF and other issues surrounding fertility, you can call the number on the screen. Doctor, you're going to give an advice, a professional advice now on someone that has PCOS. What should be the person, what assurance, what guarantee can you give, and what should the person do to succeed in the IVF?
Thank you very much. So first, the symptoms. As we mentioned, we try to define the PCOS, and that definition, within that definition is where you have the symptoms. We would say one of the symptoms they have is menstrual disturbance, which can manifest as amenorrhea, oligomenorrhea. Amenorrhea means the woman is not menstruating. Oligomenorrhea means that the woman is menstruating but is coming late, 5 years and beyond. Then also they can have intermenstrual bleeding in PCOS. That's one of the symptoms that a woman can have. But remember, the other thing was symptoms of hyperandrogenism. And these symptoms of hyperandrogenism include hirsutism, where women have a hair distribution that resembles the typical male pattern. So they have hairs on their cheek, hairs on their chest, hairs on the distribution is like the typical male. So they are hirsute. Then also, apart from that, they also have oily skin. They are prone to, the skin is oily. They also can have acne. Acne means like pimples that are a bit troublesome to treat. So these are all the physical features you can see in a PCOS patient. So, of course, because they are amenorrheic, many of them present with problems with conceiving. So in managing a PCOS patient, it's a treatment you do looking at the patient's needs. So is she having acne and she wants you to treat? Many people are not ready to start conceiving, even when you are counsel them that you need to start on time because you have PCOS. They're not ready. So they want the acne is a disturbing thing for them. You have to treat that. Then, or is it the hair issues? No woman wants to be looked at as a male. So these are also can be treated. But a good number present because they're having problems with conception. So in that, you have to now look at, can they benefit from conventional treatment of infertility, or is it too late? Would they require further management, meaning assisted conception, IVF and the like. So that is the approach to managing these patients. So concerning IVF and PCOS, in fact, for those that have very bad ones, before the IVF, you are not ovulating, stayed 1 year, 2 years, they give up. Nothing can be done. But IVF has come to the rescue. Many women with PCOS are carrying their babies. So many women have their babies, so they can benefit. However, the first thing we tell every woman that has PCOS is lifestyle adjustment. That's the key. You have to adjust your lifestyle, meaning diet and exercise. You must embrace that. Adjust your diet, more of protein diet and less of carbohydrate, especially refined carbohydrates, there's refined sugar. They are also do some exercise.
Okay, all right, Doctor. Before in the course of your interaction, while mentioning the symptoms, Dr. Carlo has talked about hairy women having PCOS. So, do all hairy women have PCOS?
No, not all women have PCOS. There are some women that they have what we call idiopathic hirsutism. Okay, so I think it's about 70%, 57% of women with PCOS will have that hair distribution. About 50%, I think, will have that hair distribution as part of their PCOS, and then it's in various degrees. Some will just have a little few strands of hair on their chin, while some will have full blown, even on their hands and legs. You know, so we can't point at every woman we see and say, oh, you have PCOS, because we see the two hair on their, they have side bones. No. So it's very important that we know that. So by and large, everybody that has any doubt should get to the hospital
and get diagnosed. Okay, so talking about diagnosis, what are the consequences of this diagnosis? And that would be maybe a kind of summary so that we can run off from there.
Okay, the consequences, we mentioned that of infertility, we mentioned that of lifestyle, as in the quality of lifestyle of their life will be reduced, because if you're having menstrual irregularities and menstrual problems, it could be very depressing. But then there are some consequences that are long-term. Metabolic disorders, hypertension, diabetes, they are more prone to that. Remember we talked about insulin, then they're also prone to some cardiovascular problems because of the lipids are also dyslipidemia. Lipids are also deranged, so they're also prone to. And then because of the unopposed estrogen effects of these follicles, they are prone to having endometrial hyperplasia and endometrial cancer. And so that is the reason why we don't advise them to stay too long without menstruation. We try to induce the menses like periodically to protect against more of these effects.
All right, thank you so much. Okay, Dr. Carlo, your final word as we run it off from here.
PCOS is common in our community, in our environment, and adequate and early treatment can help to ameliorate the situation.
Okay, so it is curable.
It is not curable, but it can be managed.
Okay, all right. Thank you so much for your time today, and we hope to see you again in our next episode of the program. All right. So it has been on our program Fertility Hour today. Thank you for being a part of it. Remember that you can reach us on the number on the screen, and in case you have any inquiry and you are living within Oyo, just take a walk to Life Point Fertility Center and you will be attended to. I remain Clement Barakui. Remember to join us again, same time, same station.
To worship with us at Christ Rescue Ministry International, also known as Rescue Tabernacle, located at number 10 Basi Esau Street off Akaitiam Street, Oyo. Weekly activities Mondays to Fridays 10 a.m. to 4 p.m. Counseling and prayers Sunday 8 a.m. to 12 noon. Prophetic worship service Wednesdays 5:30 p.m. to 7:30 p.m. Word encounter and miracle service third Friday of every month 6 p.m. to 9 p.m. Spiritual warfare and deliverance service. Christ Rescue Ministry, raising hope for the hopeless. Come and be blessed. Apostle and Reverend Mrs. Ntia E. Ntia, President.
You are all that matters.
She cries. She cries in anguish and in pain. She bears the scourge of her grief. She toils in vain for justice and succumbs to silence. He gloats over his malady. Like a beast, he pounces with no remorse. she cry in vain? Her adversaries will henceforth bear the brunt of their cruelty. Rape is evil. Rape is a plague, a pandemic of monumental consequences. We must unite and kick it out of our society.
Connect with NTA and stand against rape and rapists. This message is brought to you by the Nigerian Television Authority.
NTA Parliament is a dedicated 24-hour channel that broadcasts the activities of the Nigerian Senate, Federal House of Representatives, and all the 36 state houses of assembly. You can watch NTA Parliament on NTA StarTimes DDT platform. NTA Parliament, strengthening Nigeria's democracy.